So, happy Monday or whatever day you're watching this video. My name is Amanda Morse and this is my pocket guide submission for NU-629 Advanced Health Promotion. So I decided to do a 3-ring binder with tabs and page protectors just because that's what works for me. I started with a table of contents. I have technically 44 entries, but some of them are kind of small, so it's not that much, but started with that. Everything's labeled. I kind of went through and did it by age range. So I started with, I don't know if you can see that, with pediatrics, and then went on to well woman, pregnancy, well adult, and then well elder. So I start with pediatrics. So the first thing I added was the CDC immunization schedule for children 18 years and younger. I thought that was really important. Then I moved on to some age ranges for pediatric patients, the general vital sign listings there, and then the newborn history taking and assessment. This is the physical exam for the newborn. Just kind of listed some generals for that. I listed out the infant reflexes and when they were integrated by and what they looked like. I also included nutrition, elimination for the newborn, some considerations for that, as well as sleep and age-related physical exam considerations for the pediatric patient. This is just a little table that I made that includes some developmental milestones, and so I listed the milestone here on the left, and then what category they fell into, whether it was gross motor, fine motor, cognitive language, physical, psychosocial, and then the age when they usually show up with. Next section is well woman. You can see that. So the beginning is the components of the GYN exam. And this is kind of a longer one, so it goes on for a couple of pages. I included some infographics just about what the different types of cervix can look like, the internal and external fluids of exam, positions of the uterus. Then I moved on to cervical cancer. Some risk factors for that. Just a couple things on cervical cancer. You can see that. Just some information about how they test for it and the type of procedures that they do when they're looking for cervical cancer. Some genetic risks, so this can be for cervical cancer as well as other types of cancer, for like breast cancer, and some how we assess for genetic risk. If you can see that. And then we also have the current well woman screening guidelines there. And this goes more into pap smears and then the American Cancer Society recommendations for mammograms. You can see that. And then the last one is just a little bit more about pap smears and kind of how we go about doing the pap smear and the different tests that we do if they come back as abnormal. So the next section is on pregnancy. So I started with preconceptual counseling, moved on to there just talking about the history that we would need to take for that. Let's see here. So that's more about the preconceptual counseling there. And then starting on to the first prenatal visit, if you can see that. And then moving on here, same thing as part of the first prenatal visit, and then the physical exam of the pregnant woman. And then I included a picture, I don't know if you can see that, on pelvimetry, just because this was something that I had a hard time visualizing without a picture, so I thought that would be important and helpful for me. This is a page on lab results that we would look for, things that we would test for in the pregnant woman or in the pre-conceptual woman. And then just some counseling for pregnancy, things like nutrition counseling, exercise, sex. And then moving on to fetal development, I just included a little graphic on the different stages of the fetal development. And I think this is important because I kind of noted it down here, but basically why it's important to reach a woman early on in her pregnancy, right after she's had a positive pregnancy test, because it's there's rapid development in the first 8 to 12 weeks. And then just some information on diagnosing pregnancy. Let's see that. And then dating pregnancy as well, and then the Healthy People 2020 goals for pregnant people. And then just the different weeks for the trimesters. So then moving on, this is just some more about routine prenatal care and just the different things that we do at different stages of the pregnancy. Different like times for ultrasounds, when we do different lab tests, when we would give ROGAM, stuff like that. And then this is some information about fetal well-being. And this is more about ultrasounds as well as fundal height and what to look for there. You can see that. And then I included 2 diagrams here. I talked about Leopold's maneuver at the bottom here, and then I just included a diagram on how we would do Leopold's maneuver as well as some information on fundal height and kind of what to look for there. Just a little diagram to help you out. This is on non-stress testing and some information on that. There's just a little picture of what that would look like, and then as well as some nutritional considerations in pregnancy, just a little bit more information on that. And this is a food safety for the baby and mother, just some information about like foods to avoid, how to cook foods properly in pregnancy, and some, you know, bacteria that can commonly cause complications in pregnancy. And this is from the USDA. And then lastly, just because folic acid is so important, and obviously, you know, women should be taking their prenatal supplements, but I also included some information about top foods that have folate in them, just to have a quick reference if somebody were to ask, you know, like just examples of that. All right, moving on to the well adult. All right, and so I started with this. I said, you know, what barriers to prevent primary care delivery, because there's a lot of them. And just kind of the things that prevent people from getting proper primary care. And then I talked a little bit about the levels of prevention as well as sensitivity and specificity of a test or a tool. This is some more about screening tests. This is more about considerations to think about with screening tests, like when would we do certain screening tests? What are we looking for a screening test? Is it worth doing based on the grade that the U.S. Preventative Task Force is giving it? Just some things like that. And then as well as the well adult visit basic steps, just quickly at the bottom there. Moving on here. So this is some history points for a well adult. If you can see that, just some things to go over to get a really good history on your adult patient. One of the big things I looked at was depression, and I kind of talked about some of the different depression screening tools that we use, such as SIG caps, I'm sorry. And then actually included the PHQ-2 and the PHQ-9 as well, just to have a quick reference there. If I wanted to make a copy or something while I was in clinical, I would have it available to me, as well as the grading for it. And then as well as the audit tool, that's the alcohol screening tool. So I use that as well as the grading for that, the scoring for that, just to have quickly available to me. And then just some more general screening, something we would want to do either at every visit or, you know, how often we want to be doing them for the adult. So like height and weight, blood pressure, this includes like the parameters, how often we're going to be doing it, lipids, different cancer screenings depending on the patient and their risk factors and their age. Just some more general screenings, including STDs, diabetic screening, the dental and oral and hepatitis screenings, osteoporosis, and then this is just screenings for select populations. So screenings that you wouldn't necessarily do on every single patient that you had, but depending on their risk factors. Like for example, you know, for some people like myself as a healthcare worker, would want to be tested for TB on a regular basis because I might be exposed to it more than the average person. Okay, last section, and this is probably the biggest section because I work with elder adults, and this is, you know, a lot of information is most pertinent to me. So the well elder section. So this is just some characteristics and chronological aging categories for the older adult, as well as the components of the elder evaluation. And I kind of just listed different components of that. So that can be like physical components, how well they're doing with their ADLs, and then their psychosocial components of the exam. Okay, so some common concerning presentations in elders, as well as looking at their functional status. So I included ADLs as well as IADLs and kind of differentiated there. So things that we would look for, like, you know, what does this elderly person need to be able to do to live at home independently? What do they need to be able to do to be a community dweller? And then just some information about why physical activity is so important in the elder adult. I have a page about falls here because falls are really prevalent with the elder adult, the older adult. Just come out etiology, risk factors, and then getting a good fall history on your patient. Top section is about pain in the older adult, how it can differ from pain in a younger person, and why that can impair them more than maybe a younger person might be impaired by it, and then some statistics about that. This is some information about driving, you know, predictors of motor vehicle accidents, as well as assessment of driving risk factors in the older adult. All right, and then, so this is about cognitive function of the older adult. So this includes some information about Alzheimer's disease and vascular disease. And on the next page, I included the mini mental exam and the mini cognitive exam, again, because I work with older adults, so this is something that would be really good to have kind of quickly on hand to be able to use. And I use this sometimes in my daily practice anyway, so it's good to have it kind of written out. And then I included the scoring for it as well. So that was a mini mental, and then the mini cognitive exam is here. Some more information about the older adult is the depression. So some risk factors and some common findings for depression, and how older adults may not show up with major depressive disorder using typical scales because they have different symptoms. And so because of that, we can use regular scales, but we also might want to use the geriatric depression scale because it's more tailored to people of that age. And so I included that as well in here to have to use, and then the scoring for that as well on the other side. This is some information about polypharmacy. So some risk factors for adverse drug effects, some medication reconciliation, some information on the brown bag technique, you know, having patients bring their medications with them. And then some information about the Beers criteria medications, which are really important. And then some safe medication prescribing practices. And then moving on from that, I did some information on continence, very prevalent issue in the older adult, as well as sexuality. And then some immunization, primary care and secondary care, primary prevention and secondary prevention and screening assessments in the older adult. So a lot of these obviously will be the same as, you know, the well adult, but there are some specific ones for the older adult that I included here, like the Pneumovax and the shingles vaccine and cancer screenings. And then the last little part I had here, this is more about immunizations here. And then I did include like a comprehensive list of all the Beers medications. I know that this is probably, you know, I don't need to know every single one of these, but it would be good to be able to reference back and kind of, I highlighted the top ones at the beginning to the categories that they're in, just to see which medications I might be wanting to avoid or giving different ones if I can. So that is my pocket guide. Thanks for watching.